If you're over 70 and your doctor just smiled because your blood pressure finally reached perfect numbers, I need you to stay with me for a moment, because what I'm about to tell you may completely change the way you think about blood pressure after age 65. For years, older adults have been told the same thing over and over again. Lower is better. Get it below 120/80. Perfect numbers mean better health. But what most people don't realize is that for seniors, blood pressure that's too low can sometimes become more first pressure, dangerous than blood pressure that's slightly high. And this is where things become dangerous, because every single week, older adults are ending up in emergency rooms after falls, fainting episodes, broken hips, confusion, kidney problems. Not because their blood pressure was too high, but because it was pushed too low. I recently spoke with a patient named Margaret. She was 82 years old, sharp mind, independent, still gardening every morning, still driving herself to church. Her doctor had aggressively lowered her blood pressure from the 140 seconds down into the low 120 seconds. On paper, everything looked wonderful. But one night, Margaret stood up to use the bathroom. The room spun, her legs weakened, and before she could grab the wall, she collapsed. That fall fractured her hip, and sadly, her life was never quite the same afterward. Now listen carefully. I'm not telling you high blood pressure is harmless. It absolutely is not. Very high blood pressure increases the risk of stroke, heart attack, heart failure, kidney disease, and dementia. But what I am telling you is that aging changes the body. And after a certain age, the rules become different. Your body at 80 is not the same body you had at 45. Your circulation changes. Your arteries change. Your brain's blood flow changes. Your balance changes. Even the way medications move through your body changes. And today, I want to walk you through the real truth about blood pressure for older adults. Not the simplified version. Not the one-size-fits-all version. The real version. The version most seniors are never told. And later in this video, I'm going to show you a simple at-home test that could reveal whether your blood pressure is dropping dangerously low every time you stand up. This one little test could potentially prevent a devastating fall. I'm Dr. Caldwell, and my goal today is simple. I want to help you stay independent, stay steady on your feet, and protect both your heart times and times your brain as you age. And before we go further, I'd love for you to leave a quick comment below and tell me your age, just your age. And if you've ever felt dizzy when standing up from a chair or getting out of bed, type the word dizzy. I read these comments carefully, and you'd be surprised how many people experience these symptoms without realizing they may be connected to blood pressure. Now, let me explain what's really happening. For decades, medicine focused heavily on lowering blood pressure, and honestly, that approach saved millions of lives. For middle-aged adults, especially people in their 40 seconds, 50 seconds, and early 60 seconds, controlling high blood pressure dramatically reduces strokes and heart disease. That part is true. But here's the problem. Many of those same guidelines were later applied to people in their late 70 seconds and 80 seconds without fully accounting for how aging changes the body. Think of it this way. Imagine watering a garden with a brand new hose. The hose is flexible, smooth, water flows easily. Now imagine a hose that's been sitting outside in the sun for 30 years. It becomes stiff, less flexible, harder to work with. That's very similar to what happens to arteries as we age. Your arteries naturally stiffen over time. Doctors call this arterial stiffness. When arteries become stiffer, the body often needs slightly higher pressure to push blood efficiently to critical organs like the brain and kidneys, especially when standing up, especially when walking, especially during the night. And this is where many people run into trouble, because a blood pressure number that looks beautiful while sitting quietly in a doctor's office may become dangerously low once that person stands up. And that sudden drop can reduce blood flow to the brain within seconds. That's when dizziness happens, blurred vision, weakness, fainting, falls. One major study published in the Times Journal of the American Medical Association Times followed thousands of older adults and found something surprising. Seniors with aggressively lowered blood pressure had significantly higher risks of falls, kidney problems, and even increased mortality compared with those in a more moderate range. Now, does that mean you should ignore high blood pressure? Absolutely not. But at times does mean blood pressure targets should be individualized, especially after age 75. Here's what frightens me the most as a physician. Many seniors who are over-medicated don't realize it, because the warning signs are subtle at first. A little dizziness, a little fatigue, slight brain fog, feeling unsteady when turning quickly, needing a moment before walking after standing. People brush these symptoms off. Oh, I'm just getting older. But sometimes, those symptoms are actually your brain warning you that it isn't getting enough blood flow. Stay with me because this part matters. Your brain is incredibly sensitive to blood pressure changes. It needs steady circulation every second of the day. When blood pressure drops too low, even briefly, the brain struggles. Imagine trying to water the top floor of a building with weak water pressure. The upper floors barely get enough flow. That's exactly what happens when blood pressure suddenly crashes after standing, and unfortunately, older adults are especially vulnerable because of something called orthostatic hypotension. Now, don't let the medical term scare you. It simply means this: your blood pressure drops too much when you stand up, and the older we get, the more common this becomes. I once treated a retired school principal named Harold. Harold was 79. His blood pressure sitting down looked excellent. 122/76. Every doctor congratulated him, but Harold kept describing strange episodes. When he stood up quickly, he'd feel like the room tilted. He became nervous walking downstairs. One morning, he nearly fainted while brushing his teeth. We finally checked his standing blood pressure. Within seconds of standing, it dropped into the 90 seconds. That explained everything. His medications were simply too aggressive for his aging circulation, and once we adjusted them carefully, his dizziness improved dramatically. That's why numbers alone never tell the whole story. You have to treat the person, not just the chart. And there's another reason this conversation matters so much. Many older adults are terrified of high blood pressure, but nobody talks enough about the fear of falling. If you've never watched an elderly parent lose confidence after a fall, you may not understand how life-changing it can be. I once cared for a gentleman named Walter. Walter was 84, strong man, former carpenter, still proud of doing things himself. His daughter told me something heartbreaking after his fall. She said, "Dad stopped feeling like himself." And that sentence stayed with me. Because before the fall, Walter still walked to the mailbox every morning, still trimmed his hedges, still fixed little things around the house. But after one fainting episode related to low blood pressure, everything changed. He became cautious, then fearful, then inactive. And inactivity in older adults becomes dangerous very quickly. Muscles weaken, balance worsens, energy drops, confidence disappears. This is why protecting mobility matters just as much as protecting the heart, sometimes even more. So what's actually considered healthy for seniors? This is the question everyone asks, and the answer is more nuanced than most people expect. For many healthy adults between 65 and 74, a systolic blood pressure somewhere around 130 to 140 may be very reasonable. For adults between 75 and 85, many experts now believe a slightly higher range around 135 to 145 may actually be safer for many individuals, especially if they experience dizziness, especially if they're frail, especially if they've had falls, especially if they have kidney disease. And for adults over 85, or those with significant frailty, doctors often prioritize stability and quality of life over aggressively low numbers. Now listen carefully. I'm not saying everyone should aim for higher blood pressure. Some older adults absolutely do benefit from tighter control, particularly those with recent strokes or certain heart conditions. But what most people don't realize is that the ideal blood pressure for an 8-2-year-old may look very different from the ideal pressure for a 5-2-year-old. That's the key. Individualization, personalization, context. Because medicine should never be cookie cutter. Now let's talk about something else most seniors are never told. The body's internal pressure sensors also age. These tiny sensors help your body react instantly when you stand up. In younger adults, They work beautifully. You stand up. Your body immediately tightens blood vessels slightly. Your heart adjusts. Blood flow stays stable. But aging slows this response. Think of an old thermostat in a house. A brand new thermostat responds quickly. The old one reacts slowly. That's very similar to what happens inside the aging cardiovascular system. And when medications lower blood pressure too aggressively, the body may not react fast enough to keep blood flowing properly to the brain. That's when people feel that sudden wave of dizziness, that whoa feeling, that brief blackout sensation. Some seniors describe it as feeling like the floor moved underneath them. Others say their vision darkens for a second, and many people never mention these symptoms because they assume it's simply part of aging, but sometimes it's a warning sign hiding in plain sight. Now, let's talk about the bottom number, the diastolic pressure. This is something many seniors never hear about. Everyone focuses on the top number, but sometimes the bottom number tells an equally important story. The heart receives its own blood supply during relaxation during the diastolic phase. So when diastolic pressure becomes too low, the heart muscle itself may not get adequate blood flow. Think of it like charging a battery. The charging happens during rest. If pressure becomes too low during that resting phase, the heart can struggle. Very low diastolic pressure has been associated with fatigue, dizziness, weakness, and sometimes worsening heart symptoms in older adults. This becomes especially important in seniors with stiff arteries. And many older adults unknowingly end up with diastolic pressures in the 50 seconds because medications are pushing them too low. Again, this doesn't mean medication is bad. Blood pressure treatment saves lives. But over-treatment can create new problems, and balance matters. Always balance. I remember one woman named Patricia. Patricia was 77 and extremely disciplined with her health. She never missed medications, never missed appointments. She followed every instruction perfectly. But over time, she started feeling exhausted. Not sleepy, exhausted. She told me, "Dr. Caldwell, I feel like my energy disappeared." Her family thought she was depressed. But when we looked deeper, her blood pressure was running extremely low during parts of the day. Her body simply wasn't getting the circulation it needed. After carefully adjusting her medications with close supervision, something incredible happened. Her energy slowly returned. She started cooking again, walking again, laughing again. And this is why medicine should never focus only on numbers. The goal is helping human beings feel functional and alive, not just achieving textbook perfection. Now, I want to show you something extremely important. And honestly, I wish every adult over 70 knew how to do this. You can check for dangerous blood pressure drops at home in just a few minutes. Here's how. First, lie down and rest quietly for 5 minutes. Then check your blood pressure while lying down. Write the numbers down. Now stand up carefully. Immediately check your blood pressure again. Compare the two readings. If the top number drops more than 20 points, or the bottom number drops more than 10 points, that may indicate orthostatic hypotension. And this is where things become dangerous. Because that means your brain may briefly lose adequate blood flow every time you stand. Now imagine that happening in the middle of the night, or on stairs, or while carrying groceries. This is one reason falls become so devastating in older adults. And sadly, many seniors are never checked for this during routine appointments. That's why home monitoring matters so much. Not obsessively, not fearfully, just intelligently. A calm awareness of your body, a calm understanding of patterns. That knowledge can be incredibly protective. And while we're talking about falls, let me explain something else. Families often misunderstand. A fall is rarely just a fall in older adults. It can begin a chain reaction. Hospital bed rest weakens muscles quickly. A few days in bed can reduce strength dramatically in seniors. Then walking becomes harder. Fear increases. Activity decreases. Then balance worsens even more. It becomes a vicious cycle. That's why preventing the first serious fall matters so much. Sometimes protecting blood flow to the brain is just as important as lowering stroke risk. This is where good medicine becomes an art, not just a formula, not just a guideline, an art. Because every older adult is different. I've had 8 8-year-old patients who were healthier than some people in their 60 seconds. And I've had 6 8-year-old patients with severe frailty. Chronological age alone doesn't tell the full story. Function matters, strength matters, balance matters, kidney health matters, cognitive health matters. That's why one blood pressure target cannot fit everyone. Now let me tell you about Eleanor. Eleanor's daughter became very worried after hearing that high blood pressure causes strokes. So every single doctor visit became focused on getting mom's numbers lower. Lower, lower, lower. Eventually, Eleanor's blood pressure reached 118/68. Everyone celebrated. But Eleanor stopped walking confidently. She became exhausted. She lost energy. She stopped gardening. She became fearful of stairs. One afternoon, she fainted while standing in the kitchen. Thankfully, she survived. But her confidence never fully returned. And this is heartbreaking because quality of life matters. Independence matters. Balance matters. Energy matters. Sometimes families become so focused on avoiding strokes that they accidentally increase fall risk. And for older adults, falls can be life-changing. A broken hip at 82 is not the same as a broken hip at 32. Recovery becomes harder. Muscle loss happens quickly. Confidence disappears. Independence can vanish almost overnight. So blood pressure management in seniors must always consider the whole picture, not just the numbers. Now, there's another hidden factor that many people overlook completely: dehydration. Even mild dehydration can dramatically worsen dizziness and blood pressure instability in older adults. And unfortunately, many seniors are chronically dehydrated without realizing it. As we age, our sense of thirst weakens. The body stops signaling thirst as strongly as it once did. Some older adults also intentionally drink less water because they're afraid of nighttime bathroom trips. Others avoid fluids because of bladder leakage concerns. But dehydration thickens the blood and lowers blood volume. Think of your circulation like a river. When the river becomes shallow, flow weakens. And suddenly the brain may not receive stable circulation when standing. This is why some seniors feel dizzy, primarily in the morning. Overnight, the body loses fluids through breathing and urination. By morning, blood pressure may already be lower. Then they stand up quickly, and the brain temporarily struggles to receive enough blood flow. So, simple habits matter. Drinking enough water, standing slowly, eating regularly, monitoring symptoms. These small daily decisions can dramatically reduce risk. Now, I want to talk briefly about something emotional that many seniors quietly experience: fear of becoming dependent. Most older adults are not afraid of aging itself. They're afraid of losing independence. And honestly, that fear is understandable. That's why conversations about blood pressure should always include quality of life. Can you walk safely? Can you think clearly? Can you enjoy your day? Can you remain independent? Those outcomes matter deeply. Sometimes medicine becomes too focused on statistics while forgetting the human experience behind those statistics. But patients are not spreadsheets. They're human beings. Human beings who want to feel steady, capable, and mentally sharp. That's why I encourage older adults to pay attention not only to numbers, but also to how they feel. Because symptoms matter. Energy matters. Clarity matters. Stability matters. So what should you do? Let me simplify this. First, know your average blood pressure. Not one random reading, not one stressful doctor visit, an average over time. Second, pay attention to symptoms. Your body gives clues: dizziness, weakness, brain fog, fatigue, near fainting. These symptoms matter. Third, move carefully when changing positions, especially at night. Sit first, pause, stand slowly, give your circulation time to adjust. Fourth, stay hydrated. Dehydration dramatically worsens blood pressure instability in older adults. Fifth, talk openly with your doctor, ask questions. Ask whether your blood pressure goals are appropriate for your age and health status. Ask whether standing blood pressures should be checked. Ask whether symptoms may relate to medications. A good doctor welcomes thoughtful conversations. And please remember this: never stop medications on your own. Never suddenly change doses without medical guidance. That can be dangerous. Blood pressure treatment must be adjusted carefully and gradually. There's another part of this conversation that matters deeply: fear. Many seniors become frightened of blood pressure numbers. They panic every time they see a reading above 140. Their anxiety skyrockets, and ironically, stress itself raises blood pressure further. I've seen patients check their pressure 15 times a day. Every small fluctuation terrifies them. But blood pressure naturally changes throughout the day. That's normal. It rises when you're stressed, falls during sleep, changes with activity, changes with emotions. What matters most is the overall pattern, not perfection. And perfection is not always healthy in older adults. That idea is incredibly important, because chasing perfect numbers sometimes harms quality of life. Medicine should help you live better, not just produce beautiful numbers on paper. Now, research in older adults continues evolving, and this is important. Medicine changes over time. We learn, we adapt, we refine our understanding. Newer studies increasingly suggest that moderate blood pressure control may provide the best balance between protecting the heart and protecting the brain, kidneys, and mobility in older adults. Researchers are now paying far more attention to frailty, fall risk, cognitive function, kidney function, standing blood pressure, and overall independence, because longevity alone is not enough. The goal is healthy longevity, strong longevity, independent longevity. That's the difference. At your next appointment, here are some thoughtful questions you may want to ask. Is my blood pressure target appropriate for my age? Should my standing blood pressure be checked? Could my dizziness be related to medications? What's more important in my case? Aggressive, lowering, or stability? How do my kidneys and overall health affect my ideal target? These are smart questions, protective questions, and informed patients often receive better care because they become active participants in decisions. I want to leave you with this. Your goal is not to become a perfect blood pressure reading. Your goal is to remain steady, clear-minded, strong, independent, safe, able to enjoy your life, able to walk confidently, able to wake up each morning without fear of falling. That's what truly matters. And yes, blood pressure control is part of that, but balance is everything. Too high is dangerous. Too low can also become dangerous. The healthiest place for many older adults lies somewhere thoughtfully in the middle. So please, do not become obsessed with perfection. Become focused on stability, on function, on protecting your brain, your heart, and your independence together. If this conversation helped you understand blood pressure in a new way, leave a comment below saying informed. I always love hearing from you, and if you know someone over 65 who constantly struggles with dizziness, fatigue, or blood pressure medications, please share this video with them. It may genuinely help protect them. And don't forget to subscribe, because next time, we're going to talk about the hidden signs of dehydration in older adults that many families completely miss until it becomes dangerous. Until then, take care of yourself. Move slowly, stay hydrated, and remember, your body changes with age, and wise medicine changes with it. I'm Dr. Caldwell, and I'll see you in the next video.